So we are approaching June, and in June, you got to get ready for a big fight. And the big fight is, of course, going to be over Trump's big, beautiful bill. And I can't believe they're still calling it that. That's what Trump wanted, and Congress does what Trump wants most of the time. I'm pretty sure that most members of Congress think it's a childish name, as I do, but I digress. The bill is a massive bill. It's full of new tax cuts, extending some old tax cuts. It would keep the 2017 Trump tax cuts in place, so taxes wouldn't go up for any Americans, but it is estimated that the bill itself will add about $3 trillion to the debt in the next 10 years. And that estimate comes from the Congressional Budget Office, might not be taking into account any growth that comes from the tax cuts, which would bring in a lot of revenue, but we don't know for certain if that will happen. So for now, it is assumed that this bill will add quite a bit to the already ballooning debt, which is out of control. It's out of control. This bill would supposedly put the debt at around $40 trillion. The direction the debt is headed is unsustainable. We all know that. It needs to be addressed, and this bill does nothing to address it. They did, however, try to make some cuts in order to partially balance things out in the program, with the deepest cuts, program that the Democrats and some Republicans are most upset about, are the cuts to Medicaid. And a lot of people are upset about this. A lot of people are alarmed. Medicaid is, of course, health insurance for the poor. It's paid for by both the federal government and the state. They share the cost. So in some states, the state and the federal government, kind of split the cost 50-50. In other states, poorer states, there's a wide gap where the federal government pays about 80%, while the state only pays 20 or 90-10. And this varies from state to state, like I said. But if you are poor, Medicaid is available to you. And it's health insurance. And we know how much trouble people are having with healthcare right now. We have been struggling with this issue for years. The private insurance system is screwed up. Healthcare on its own is unaffordable. Medicaid is insurance coverage for people who either don't make enough to purchase private coverage or aren't covered by their employer. And look, we want everyone to find a way to get covered. So there's Medicaid, there's Medicare for the elderly, there are exchanges that help people find affordable care if they don't get insurance through work. So there are ways to get health insurance if you are poor, but the big, beautiful bill is cutting what they say is about $625 billion from the program. That's a lot. And the Republicans are saying that all of these cuts are simply getting waste, fraud, and abuse out of the system. We've heard that a lot from this administration, waste, fraud, and abuse. They say that that is the secret to bringing down the debt, waste, fraud, and abuse. Apparently, there are hundreds of billions of dollars in waste, fraud, and abuse in the government programs, including Medicaid. And Republicans are saying right now that they are changing who is eligible. One of the new rules is for a work requirement. So if you are able-bodied, I think mostly men, and want Medicaid, you have to put in 80 hours of work in school or doing a job or community service or volunteer work. And I think that's something that most Americans support, right? I bet if you did a poll, about 80% of Americans would support people who are able to work to go do so in order to get taxpayer money. And of course, there are questions about who is eligible. If a single mother is not working, is there an exemption? Probably. Is there an exemption for mental health care? But overall, it's a popular provision. However, at best, this provision would only save about $109 billion over the next 10 years. That's not enough. That's not enough to get up to $625 billion, obviously. But there's more. Next, they say that there are 1.4 million illegal immigrants currently on Medicaid, and they would be kicked off. Again, something that I think most people would support. But this move, which they're touting heavily, would only save about $35 billion. So where is the rest of the money? The other, $250 billion, $350 billion, where's it coming from? And there's a provision in there that would make it more difficult for people to be on the Obamacare exchanges too. That could save a little, again, but the big cuts come from a new rule concerning how Medicaid is paid for. Like I said earlier, the states pay for some Medicaid, the federal government pays for some of it. But the federal government is required to pay at least 50% of a state's Medicaid costs. This bill would lower the amount the federal government is required to pay and allowing higher per capita income states to receive less than that. And this would have to be made up by the states, many of which are already having big budget problems. And that's the most likely reason that people would lose their health insurance. And that would save an estimated $350 billion. And that's how you get to $650 billion over 10 years. That number comes from there. There's no way that people are not going to be kicked off Medicaid if the matching funds are cut. And the estimates are that, about 7 million people could lose coverage. That's the CBO estimate. And that money would not go to pay down the debt. It would be used to make the 2017 tax cuts permanent. So it would prevent a tax increase on most Americans and help pay for the other tax cuts, no tax on tips, no tax on Social Security, but it doesn't even come close to paying for all the tax cuts. And that's estimated to be about $4 trillion in lost revenue. And the GOP sold this all wrong. And Trump isn't a deft enough politician to navigate this. What the GOP should have said is, if they wanted to sell this, is that they are trying to prevent a tax increase, which is true. But instead they sold it as a tax cut. And that made it easier for Democrats to say what they always do, that these would be tax cuts for the wealthy paid on the backs of the poor. And it's an argument that the Democrats use all the time when discussing tax cuts. But this time, it really does seem to be working. In a recent YouGov poll, there are only 36% of Americans, which is kind of Trump's base, who support the bill, while 43% oppose it and 21% have no opinion. So the GOP's sales pitch has clearly not worked. Now, I think Medicaid needs reform. I don't necessarily believe the Democrats when they say that millions of children and elderly people will lose their health insurance. They say that every single time anyone talks about reforming the healthcare system. I don't think it's true. I doubt that's the case. The GOP would be crazy to give the Democrats an issue like that. If children started losing their health insurance, the media would be lining up to interview kids and old people who lost their coverage. And there would be hundreds of sob stories, and the GOP would suffer immensely as a result. And the class war concerning the tax cuts for upper income earners, it works for Democrats too, right? Everybody hates the rich. Well, not everybody hates the rich, but they're, class envy. So this is a real gambit for Trump and the GOP. But they seem to be going full steam ahead here, and we'll have to see if they get what they want when the bill goes to the Senate, right? It's already been passed by the House. Senate seems less likely to agree to the steep cuts in Medicaid because several GOP politicians, Senate Republicans, are already objecting, including some hardcore Trump supporters like Josh Hawley. Very well liked in MAGA, but something will pass. We're just going to have to see what's in the bill when the Senate gets done with it. But for now, the math doesn't really look good any way you slice it, except for the fact that it won't raise taxes by letting the 2017 tax cuts expire, which is a good thing, because that would be a big time tax increase for Americans that would be harmful for the economy at a time where things are already tough for people due to the cost of living spikes that we've seen over the past few years. But it certainly belies the fact that the GOP cares about serious debt reduction. That's not a serious argument anymore. You can't make that argument with this bill. I hope this explanation has helped you understand what's going on with the big, beautiful bill. I tried not to go too deep in the weeds, but I wanted to try to give you an idea of what it would do on the Medicaid issue. Because, after all, it's your money. And that's what I think a lot of people forget. I'm Dan Joseph. Please subscribe to Bite Size Politics Podcast. Share it with, there's Marty. Share it with your friends and family. Whatever you do, stay reasonable. This is Bite Size Politics. I'll see you.